Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on cellular adaptations to stress, atrophy, hypertrophy, metaplasia, with 4 answer choices and explanations. Cellular adaptations to stress, clinical vignettes. 1. Skeletal muscle atrophy, immobilization. A 45-year-old man fractures his right femur and is placed in a cast for 6 weeks. Upon cast removal, his right thigh appears smaller than his left. Which cellular adaptation is responsible? A. Hypertrophy, B. Hyperplasia, C. Atrophy, D. Metaplasia. Answer C. Atrophy. X-belong disuse leads to atrophy due to reduced protein synthesis and increased protein degradation via the ubiquitin proteasome pathway. 2. Left ventricular hypertrophy, hypertension. A 60-year-old man with chronic hypertension undergoes echocardiography, which shows increased left ventricular wall thickness. What type of adaptation is occurring? A. Hyperplasia, B. Hypertrophy, C. Metaplasia, D. Dysplasia. Answer B. Hypertrophy. Explanation: hypertension increases afterload, leading to left ventricular hypertrophy via increased synthesis of contractile proteins, mechanical stress adaptation. T3. Barrett's esophagus, metaplasia. A 50-year-old man with a long history of gastroesophageal reflux disease undergoes endoscopy. Biopsy reveals columnar epithelium with goblet cells in the distal esophagus. What is the most likely explanation? A. Dysplasia, B. Hyperplasia, C. Metaplasia, D. Atrophy. Answer C. Explanation: chronic acid reflux induces squamous to columnar metaplasia in the esophagus as an adaptive response to protect against acid damage. 4. Uterine smooth muscle hypertrophy, pregnancy. A 28-year-old pregnant woman undergoes an ultrasound that shows enlargement of the uterus. What is the primary mechanism of uterine enlargement during pregnancy? A. Hyperplasia only. B. Hypertrophy only. C. Both hyperplasia and hypertrophy. D. Atrophy. Answer C. Both hyperplasia and hypertrophy. Explanation: uterine smooth muscle undergoes both hyperplasia, cell proliferation, and hypertrophy, increased cell size, in response to hormonal stimulation during pregnancy. 5. Chronic cigarette smoking, metaplasia in bronchi. A 55-year-old smoker undergoes bronchoscopy, which reveals replacement of normal ciliated columnar epithelium with stratified squamous epithelium. This change is best described as A. Dysplasia, B. Hyperplasia, C. Metaplasia, D. Atrophy. Explanation: chronic irritation from cigarette smoke leads to columnar to squamous metaplasia, which is a protective but potentially reversible adaptation. 6. Prostate enlargement, benign prostatic hyperplasia, BPH. A 67-year-old man presents with urinary hesitancy and weak stream. Digital rectal exam reveals an enlarged prostate, and biopsy shows increased glandular and stromal cell number. Which process is responsible? A. Hypertrophy, hyperplasia. C. Atrophy, metaplasia. Answer B. Hyperplay. Explanation: BPH results from testosterone DHT induced proliferation of prostate glandular and stromal cells, leading to hyperplasia. 7. Brain atrophy, Alzheimer's disease. A 78-year-old woman with progressive memory loss undergoes MRI, which shows cortical thinning and enlarged ventricles. Which cellular adaptation is occurring? A. Hypertrophy, B. Hyperplasia, C. Atrophy, D. Dysplasia. Answer C. Atrophy. Explanation: neurodegenerative diseases such as Alzheimer's cause neuronal loss and brain atrophy due to apoptosis and synaptic dysfunction. 8. Chronic kidney disease, atrophy of nephrons. A 65-year-old man with diabetes and hypertension develops chronic kidney disease, CKD. A renal biopsy shows smaller glomeruli and tubules. What type of adaptation is occurring? A. Hypertrophy, B. Hyperplasia, C. Atrophy, D. Metaplasia. Explanation: CKD leads to nephron loss and atrophy due to decreased blood flow and chronic injury. Surviving nephrons undergo compensatory hypertrophy. 9. Chronic alcohol use, liver adaptation. A 50-year-old man with chronic alcohol use undergoes liver biopsy, which shows excessive hepatocyte proliferation with mild fibrosis. Which cellular adaptation is most likely responsible? A. Hypertrophy, B. Hyperplasia, C. Metaplasia, D. Answer B. Hyperplasia. Explanation: Alcoholic liver disease can lead to hepatocyte hyperplasia as the liver attempts to regenerate, but chronic injury may eventually cause cirrhosis. 10. Callus formation, hyperplasia in response to mechanical stress. A 30-year-old construction worker develops thickened skin on his hands due to repeated friction. Which cellular adaptation explains this change? A. Atrophy. B. Hypertrophy. C. Hyperplasia. D. Metaplasia. Answer. C. Explanation. Chronic mechanical stress induces epidermal hyperplasia, forming calluses to protect the underlying tissues. Key takeaways for cellular adaptations to stress. Atrophy, decrease in cell size or number due to decreased workload or nutrient supply, e.g., disuse atrophy, brain atrophy, and Alzheimer's. Hypertrophy, increase in cell size due to increased demand, e.g., left ventricular hypertrophy and hypertension, uterine hypertrophy and pregnancy. Hyperplasia, increase in cell number due to hormonal or mechanical stimuli, e.g., BPH, liver regeneration, callus formation. Metaplasia, reversible replacement of one cell type with another due to stress, e.g., Barrett's esophagus, squamous metaplasia, and smoking.